Reimagining Rural Health, a podcast series brought to you by Sanford Health. In this series, we explore the challenges facing healthcare systems across the country, from improving access to equitable care, building a sustainable workforce, and discovering innovative ways to deliver high-quality, low-cost services in rural and underserved populations. Each episode examines how Sanford Health and other health systems are advancing care for the unique communities they serve. In this episode, Courtney Collen with Sanford Health News talks with Dr. Tommy Ibrahim, former president and CEO of Bassett Healthcare Network. Dr. Ibrahim joins as keynote speaker at the 2023 Summit on the Future of Rural Healthcare with the topic, Future-Proofing Our Workforce. What can we learn from each other about preparing for the next generation of care?
I am joined by Dr. Tommy Ibrahim. He is here in Sioux Falls from New York. Welcome.
Thank you so much.
To the podcast.
Thanks for having me.
We're happy to have you. What are the top 3 opportunities you see when it comes to building a stronger rural healthcare workforce?
I think first and foremost, we really need to take a hard-in approach and listen to our people. There's a lot of change and dynamic sort of paradigm shifts that are happening now in the industry. I would even argue that there are some permanent shifts happening around workforce, and our ability to sustain, successful workforce models in the future are going to be contingent on how we could re-engage our workforce and our people. Our people know exactly what they're looking for, they know what they want, they know what works, what doesn't work, and I think as leaders, it really is incumbent on us to be there to listen empathetically and to begin to customize solutions that meet their needs first and foremost.
Where have we made progress when it comes to healthcare workforce issues? Where does work remain? How will this shape strategy and policy moving forward?
I think we've seen a lot of momentum catalyzed throughout and after the pandemic. I just sort of reflect on virtual care, for example. I remember having conversations with my medical staff, just prior to the pandemic about how impossible virtual care models were going to be, implemented. And, in the height of the pandemic and the initial surges, we saw a 10,000% increase in the number of virtual visits that manifested across the organization. So that essentially happened all overnight. So the initial impossibilities became truly magnified potential that we now continue to enjoy across the entire spectrum of the healthcare industry. Obviously, those levels have not been sustained, but we're certainly doing much better today than we were prior to the pandemic.
Thank you for the insight.
Yeah.
If you could share one piece of advice with a new clinician, physician, entering the workforce today, what would that be?
I think it's really important and sort of maybe a really obvious thing to say, but the consumer and the patient is going to be absolutely essential. I still believe that we are in a provider-centric healthcare system, and I think we need to rapidly shift the focus to the consumer to meet the desires, the needs, the wants of our patients, to put team-based care around our patients and to support all of their care needs holistically.
What excites you the most about the future of rural healthcare?
I really love the focus on rural healthcare right now. I think it's more than just rhetoric. I think there are true interests and sincere, focus points across the entire segment. And our lawmakers are saying all the right things. I think our leaders are certainly mobilized and activated to advance our priorities. And I think we just need to be resilient and diligent. And despite all of the challenges that we view and see as leaders today in healthcare, I think it's a really exciting time in general to be in this moment, I think, and to have this great responsibility to be able to shape the future of healthcare.
Well, we appreciate your time and all that you do.
Thank you so much for having me.
You've been listening to Reimagining Rural Health, a podcast series brought to you by Sanford Health. Hear more episodes in this series or other Sanford Health series on Apple, Spotify, and news.sanfordhealth.org.